Well, right now, we know hospitals are dealing with an influx of COVID patients. That means there is now a backlog of delayed procedures that continues to grow. It's a problem we're seeing right across the country. Saskatchewan now saying it is exploring options to bring in third parties to deliver some healthcare services, trying to alleviate this backlog. Some of those services could be for profit. Could privatizing healthcare services help to clear up backlogs right across the country? And what would the implications of doing so be? With us this morning is Dr. Melanie Bechard. She's a pediatric emergency physician and chair of Canadian Doctors for Medicare. Good to have you with us.
Thank you.
An Ipsos poll from December found that 58% of respondents wanted to see an increased access to private healthcare services. Now, we already have privately delivered healthcare in Canada, things like long-term care, for example, or physiotherapy. Those aren't covered under provincial health plans. When people say they're advocating for greater access to privatized healthcare, what are they advocating for?
A lot of the time, people want faster access to care. The unfortunate bit is that private healthcare is not the option. Even if we create these standalone private options, we have to realize we have a limited number of healthcare providers. And if we pull doctors and nurses out of the public system to work in these private locations, there will actually be fewer healthcare providers to care for the majority of patients.
A study by the Canadian Medical Association just last month in December found that there's a backlog of more than 325,000 procedures across the country. I mean, that's an incredible number. Wouldn't privatizing more healthcare services help to clear some of that backlog?
There's a lot of evidence that having multi-payer systems where you have parallel private systems is actually a lot more inefficient. Things that have been proven to help reduce wait times are things like a centralized referral list so that patients are sent to the surgeons or healthcare providers with the shorter wait lists, and multidisciplinary teams, which might help to alleviate the need for surgery altogether in many cases.
You know, anecdotally, we hear stories. I mean, we know somebody from out west who waited a year and a half for hip replacement surgery, couldn't wait any longer, and then crowdsourced to raise the money to have it privately done. I mean, this is happening. This is where we're at right now in this country because of, the COVID crisis. So what options can the government pursue within the public healthcare system then to help reduce wait lists and clear some of these backlogs, get people the healthcare that they've been waiting for?
That's a great question. One of the key things we really need to look at is funding our healthcare system appropriately. Compared to many other nations, Canada actually spends a lower proportion of its health funding on our public healthcare system. And when it comes to hospitals, we actually spend below the OECD average. So looking at really strengthening our public healthcare system can help to avoid these situations where patients wait heartbreakingly long amounts of time for care.
So let me ask you this then, Doctor. Our public health care system wasn't designed to handle a pandemic. It was designed to take care of the needs of Canadians. Is it not beneficial in this circumstance to try a different model, at least for this time of pandemic, and then in the meantime, try to bolster up what we've already got?
The solution is simply not going to help us very much. During the time of the pandemic, our healthcare needs are even more acute, meaning that we need to really strengthen our public healthcare system. If we create these private pay options, we might achieve faster action for a small majority of patients, a small fraction of patients who can actually pay for the care, but would actually worsen wait times for so many of those 300,000 patients on that wait list.
How would it worsen? How would it make a wait time longer?
Because when we have a limited number of healthcare providers in Canada, if we start taking them out of the public system to work in a private system, we're going to have fewer healthcare providers to care for the vast majority of patients who are still in the public system. We've seen this in other countries like Germany and Australia, where when you create this parallel private system, it actually worsens wait times. Absolutely, we need all hands on deck to solve the problems in healthcare in Canada, but private pay is just not the solution.
People who advocate for private pay will say that this is one of those examples of an area in, our publicly funded system where when you shine the light on it during a pandemic, a time of crisis, you see where the cracks are. What's your response to that?
All healthcare systems have cracks. Unfortunately, the cracks that people are noticing are not in the right places. We do have comparatively an underfunded healthcare system in Canada. Giving it proper funding is likely going to be a much better and more efficient solution. And we need to keep in mind, too, that we have a neighbor to the south, the United States, with many private insurance companies that would love to open up to the Canadian market. Very few people want to have American-style healthcare in Canada. Very few people want a rich person's convenience to trump a regular person's access to healthcare. So that's something we really need to be aware of. This time of crisis is a time to bolster our public healthcare system, not to destroy it.
We'll have to leave it there. Dr. Bechard, thanks for joining us this morning. Good to have you.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.